Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Malaria remains one of Africa's deadliest diseases, killing nearly 500,000 children under the age of 5 every year, according to the WHO chief, Tedros Adhanom Ghebreyesus. The muscularous RTSS vaccine, developed by British pharmaceutical giant GSK, has already been administered to more than 1.7 million children in 3 African countries, Ghana, Kenya, and Malawi, as part of a pilot program. It has been shown to be safe and effective, resulting in a substantial reduction in severe malaria and a fall in child death, Tedros said. In addition to the 3 test countries, which will continue to receive doses, 9 other countries will benefit from supplies, WHO, UNICEF, and the Vaccine Alliance, Gavi, said in a statement. They are Benin, Burkina Faso, Burundi, Cameroon, the Democratic Republic of Congo, Liberia, Niger, Sierra Leone, and Uganda. Nigeria has been exempted from the list of 12 African countries that are set to receive the 18 million doses of the first ever malaria vaccine. This was disclosed by Gavi, the Vaccine Alliance, the World Health Organization, and the United Nations Children's Fund. The first vaccines are expected to arrive in the last quarter of 2023 and be deployed in early 2024. Although in April 2023, National Agency for Food, Drug Administration and Control gave provisional approval for the R21, otherwise known as Matrix malaria vaccine, and said it will begin clinical trials in mid-August with an earlier supplied doses. Now let's take a look at the report.
Conversations around the malaria vaccine have recently generated lots of interest in Nigeria, and it is also the crux of the discussions at this conference in Abuja.
Some of our partners are listed.
To set the tone for the conversations, a survey report on how some Nigerians respond to symptoms of malaria is presented.
What we thought was critical to also identify here is people's practices when they have symptoms of malaria. We did ask a question asking people if they can identify the symptoms of malaria, and they were able to do that. And then we went on to ask them what do they do when they have malaria. And it's of particular concern that only 41% of those that we spoke to said that they will go to the hospital.
The survey reveals that only 41% of people who develop malaria symptoms visit the hospital, 22% rather go to a medicine shop, 21% consult a pharmacist, while 11% use herbs. On April 17 this year, the National Agency for Food and Drug Administration and Control, NAFDAC, gave provisional approval for the use of the R21 malaria vaccine in Nigeria. While some hope that the vaccine will be the game changer, recent studies have shown that it is not a silver bullet.
Various research also have shown that the effectiveness of the vaccine is approximately 60%, but it significantly wanes over time, even with the booster dose. And what we know now is that the protection is for about 12 months.
Currently, the R21 malaria vaccine is unavailable in Nigeria. When the earliest expected doses arrive, they will be deployed for further clinical trial.
We are going to have our own follow-up trials, a phase 4 trial. The protocol should be ready anytime from now. I think the deadline was is middle of August. So those doses really are going to be used for that trial, because we also need to validate the data. In terms of receipt of the doses, I don't think they've arrived yet because the protocol is yet to be approved.
According to the World Malaria Report, Nigeria accounts for 31% of the 619,000 deaths recorded globally from the disease in 2022. However, recent studies on the R21 malaria vaccine have shown that it is over 60% effective and can give protection against the disease for up to 12 months. Hence, some medical experts are optimistic that when fully deployed for public use, the vaccine will help to reduce the number of fatalities recorded each year from the disease.
Available statistics from the World Health Organization (WHO) puts the number of people killed globally by malaria in 2021 to 619,000, of which 96% of the deaths occurred in Africa. To reverse this figure, WHO Regional Director of Africa, Dr. Matshidiso Moeti, has advised member countries to make adequate budgetary allocations to the primary healthcare sector in order for malaria services to be accessible to the most vulnerable populations. Represented by WHO country representative to Nigeria, Dr. Walter Kadizi Molumbo, at an event in Abuja to commemorate the 2023 World Malaria Day, Moeti noted that concerted efforts are needed by all stakeholders to tackle malaria burden in the region.
But we can now save millions of lives each year from sickness and death caused by malaria following novel tools and progress toward disease elimination. In fact, malaria is targeted for elimination. And this is why in Nigeria we have the National Malaria Elimination Program, not just malaria control program. But to reach there, it takes some decisive action, both on the political side, but also on implementation.
April 25th is set aside for commemoration of World Malaria Day to demand for continued investment and sustained political commitment for malaria prevention and control. The date was instituted by WHO member states during the World Health Assembly of 2007.
The former Minister of Health, Dr. Sage Hanire, had assured that Nigeria will get doses of the AS01 malaria vaccine by April 2024. He noted this during the commemoration of World Malaria Day in April 2023, adding that the government has successfully submitted its application for the RTS-S vaccine allocation to Gavi, the Vaccine Alliance. We'll now join Dr. Agboe Buta, who is a consultant family physician at the State House Medical Center in Abuja, to explore perspectives on the prospects of malaria vaccines in tackling the malaria disease. Welcome to the program, Doc.
Thanks for having me.
Now, let us begin with what would you say are the prospects of this malaria vaccines? I mean, what are the benefits in combating malaria?
The journey to malaria vaccine has been a very arduous one, and it's been on for several decades. And the most promising vaccine, which has now been is being piloted in 3 countries, as stated in the earlier report, the Mosquirix is the most advanced of all the vaccines we've had so far. And to summarize the advantage of this vaccine, it has been established so far with the data we have that after 4 vaccinations spaced appropriately, the reduction in mortality, in death, in severe malaria is as much as 50%. And then the reduction in malaria cases is as much as 30%. What it means is that in Nigeria, for example, where you have a prevalence of malaria, the most recent studies showing that prevalence of malaria is as much as 22%, which varies among the region, but which translates to as much as 55 million cases per year and 90,000 deaths. These numbers are supposed to change. It would mean that the number of cases will drop from 55 million to much lower values, which will be put about absolute values about 38 million. And the number of deaths can be reduced by half from 90 to as low as 45,000. These numbers may not be perfect, but they are significant and would help in reducing our morbidity and mortality indices. But the proviso, this is the criteria of what will guarantee this kind of results would depend on the uptake of vaccination. So we will expect that patients would take the complete doses, which would mean they take 4 doses properly spaced. You take one at 0, 1 month later, and a 3rd dose on the 2nd month. And then the 4th dose is more like a booster and comes at the 18th month. And that, for children under 5, will provide significant protection against the severe forms of malaria which is responsible for death, and then, of course, for malaria in general.
It looks like you've answered my next question, but then I'm still going to have to bring you back to that. I stated earlier that about 12 African countries had to get these vaccines towards the end of 2023 and also in 2024. But Nigeria is exempted, and the former Minister of Health says in 2024, April, we're expected to probably have these vaccines in the country. Now, let us look at the challenges of acquisition, access, and equitable distribution among vulnerable populations across the health facilities, especially within the communities by 2024 and beyond.
To start with access, a significant component of the funding for this will come from sponsorship from the Bill and Melinda Gates Foundation. So the vaccine is going to reach us at a cost that is less than its production cost significantly. However, once it gets to us, we would have to take responsibility for distribution. And that is what would determine a lot in terms of access. We have a National Primary Healthcare Development Agency that has collected a lot of data with respect to how to distribute vaccine. Recently, we had the COVID virus, and a lot of lessons have been learned from that, from combating polio and all the regular standard vaccination frameworks we have in place. So we have a lot of experience in terms of distribution of vaccine. Unfortunately, our vaccine uptake and immunization numbers are still significantly low, ranging between 20 to 30%, much as 70% in parts of the country where the health system is still significantly strengthened, and you don't have the challenge. Access is going to be a challenge in certain parts of the country where we may still have some lingering challenges with security, lingering challenges with human resource capital, and the lingering challenges with deployment of resources to support this activity. Of course, there are other cultural considerations we need to take into place. We still have a significant percentage of our population who are still vaccine hesitant. They view vaccines with some level of suspicion, and therefore acceptance is going to be a challenge. Unlike the routine vaccinations where we know that most parents accept this, a new vaccine will require some level of education, advocacy to address whatever concerns our populations will have, and then to continue to use innovative ways, technology, key players in the communities, religious bodies and their heads to deploy this vaccine in order to save our kids and pain.
Going to come to vaccine hesitancy, because we've seen it with other vaccines that are available in the country. Even with the routine immunization, we still see some people who are hesitant to take vaccines. And I was going to ask, do you think the reason for this vaccine hesitancy is because these vaccines are not locally produced? They're produced elsewhere abroad, and they're brought into the country, although with approval from NAFDAC. But then what role do you think local production of vaccine, what effect do you think it has on eradicating vaccine hesitancy?
Will, to a large extent, reduce the prevalence of vaccine hesitancy, because if you are able to sell the idea to our communities that these vaccines are produced by our brothers and it's done locally, they are more likely to accept it. Because let's look at some of the things that drive vaccine hesitancy. Most of them can be classified as conspiracy theories, because a lot of our communities who believe that some of these vaccines are targeted at recalibrating reproductive capacity or increasing the risk of certain health issues. In fact, there was a time we heard that one of the common vaccines was programmed to cause death in 2 years. We've not seen that happen. So we will need to leverage on some of the opportunities we have, local production of vaccine would be a critical one, and it would be an opportunity to build capacity locally. And in addition to that, it will be used as a selling point to say, look, these vaccines were produced in Nigeria by Nigerians for Nigerians, and that to a large extent will increase the acceptance of these vaccines, because it will be considered that these vaccines are not foreign and therefore were not produced by people outside our environment, outside our and therefore open to managers with certain interests in mind. That, although that is, of course, in the conspiracy theory, the sphere of conspiracy theory, there are some of these informations that are spread widely through social media and therefore take deep roots, and it's quite difficult to re-educate our people. So therefore, local production of vaccine will be a significant addition to the fight against.
According to the 2022 WHO malaria report, Nigeria has the highest burden as 1 out of the 3 deaths from malaria globally occurs in Nigeria. These translate to 22 persons dying every hour due to malaria, an ailment which is prevalent amongst under 5 children and pregnant women, but has killed no fewer than 290,000 persons between 2020 and 2022. Despite efforts over the years, it is estimated that over 66 million cases of malaria occur annually in Nigeria. Hence, the need to not only control the spread of malaria infections, but also eradicate it completely. Stakeholders have called for increased efforts to bring malaria to zero level in Nigeria.
With the robust malaria program and some of the policies that have been put in place, government has shown clear intent. But I think we need to also take it a notch forward in terms of that leadership and that mobilizing both all the major stakeholders within the space to continue talking about the board also to back.
There are also calls to work on localized vaccine production with other countries, especially in the West African region, to reduce the economic cost on treatment and prevention of the disease.
The scale up of a malaria vaccine cannot just happen until or unless we localize it and we have in-country capacity to mass produce and make it readily available. So by innovation, we not only mean innovations in the medicine or the vaccines, but also in how quickly we're able to scale that and make it available to those who deserve it, or those who would need to have it, those like pregnant or lactating mothers, infants under 5, and even adults. How do we make it available? So you're not innovating in producing a vaccine, for instance, you're innovating in the distribution, you're innovating in inventory and stock management, you're innovating in transport system and logistics to get these drugs and vaccines to the available people, you're innovating in storage facilities of the quality that we ensure that these vaccines last.
The WHO in 2021 approved the malaria vaccine for children for the first time after a pilot scheme in 3 African countries, with Ghana and now Nigeria becoming the first countries to approve a new malaria vaccine for use in children. Although undergoing clinical trials, the vaccine is for prevention of clinical malaria in children from 5 months to 36 months of age, as there are efforts to make other malaria vaccines for children available in 2024. So we have been talking about looking at the local production of vaccine to drive acceptance of vaccination in the country. And we're well aware that many of the vaccines that has been approved in the country over the years are not locally produced. I wanted to confirm from you, do you think Nigeria has the utmost capacity to produce these vaccines, you know, in line with acceptance of vaccination?
Well, indeed, Nigeria has the capacity. Let's not forget that Nigeria used to produce vaccines and still has that capacity. In fact, in the past, one of the information we have is that the vaccine producing facility was closed down for renovation at a point, and following the closure and completion of the renovation, which may have been partially or incompletely done, it had not reopened back to provide that services. So in terms of vaccine production, yes, in more than 2-3 parts of the country, there have been demonstrable capacity in the past to produce vaccine. So indeed, yes, we can produce vaccine in Nigeria, given the necessary equipment, the human resource training, the backing, and most importantly, the political will. Once this is put in place, we can guarantee that vaccine production can commence and will be sustainable.
We know that the rainy season is one of the seasons that drive the influx of mosquitoes, and that it breeds mosquitoes, and then we have more cases of malaria. Now let us look at the effect of the season, and now, with its relationship with diseases and, the risks and allergens to be looked out for.
Yeah, yes, indeed. It's almost inevitable that during the rainy season, malaria cases are on the rise. This is because the breeding sites for malaria is more available because we have more water bodies. So indeed and definitely that is on the rise. Apart from that, of course, there's contamination of water bodies and overflow, contamination of surface water. So cases that are associated or classified as fecal-oral diseases are also equally on the rise. So all of these indeed are key factors or are key common health conditions that are going to be promoted during the rainy season because of these dynamics.
Still in line with the rainy season, we know there is diphtheria, there is Lassa fever, and even COVID-19, a new variant of the virus was discovered in the UK. I'd like to know, are these diseases likely to spike during this season?
Well, yes, indeed. Upper respiratory tract infections, viral infections are more common. There is usually a spike during the rainy season. So we expect that it's the issue of whether we would have a resurgence of COVID will depend on a lot of factors, which will include existing population immunity to similar viruses, which provide partial protection. And then also the other dynamics like the environmental temperature, which are all factors that can influence transmission. So indeed, we must be on the lookout, and it will require that we place a surveillance system in place that monitors whether cases are on the rise, and if cases are on the rise, we take the necessary measures.
Is around malaria vaccines, its availability, and also its effect in curbing the spread of the disease malaria. Now, away from vaccination, let us look at other measures that we can adapt to help us cope with these diseases.
To adapt to? Sorry, I didn't get that.
I know the conversation is around malaria vaccination. And I wanted to confirm, is there away from the vaccination now, what are the other methods or measures we can use in eradicating malaria?
The other measures obviously would be environmental hygiene, control of breeding sites, and the use of indoor residual sprays from time to time. To control the population of malaria, which is the major transmitting factor for mosquito. So to a large extent, environmental intervention is very critical. Then within homes, obviously, we would want people to net their homes to use long-lasting insecticide-treated mosquito nets, which are very also critical. Then the use of the intermittent use of prophylactic anti-malarials is one of the measures that the Federal Ministry of Health Malaria Prevention Program has put in place, because this to a large extent means that from time to time you offer treatment to the general population, focus on children under 5 in order to prevent malaria transmission, irrespective of whether they are at that point having malaria or not.
That's the much we can take from you, Dr. Agbo. Thank you so much for coming on the program. We do appreciate it.
Thank you. I appreciate it.
And we hope that the malaria vaccines get into the country as expected in 2024. And we hope that the uptake of these vaccines are taken by communities, by the vulnerable population within the communities, just so we eradicate malaria. Now, thank you so much for joining us on the program. For comments, contributions, and suggestions, do well to follow, subscribe, and like all of our social media platforms. Join us again on another episode of the program, Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for your time.